Hi there, Personal Health and Wellness. Welcome back to our second installment in substance abuse. And I decided to separate this out so that I could develop two videos and make one specifically about tobacco. And that has more to do with the fact that, as you've seen, we have connected tobacco to so many different things. We started out with cardiovascular disease, looking at how tobacco was the leading modifiable risk factor there. But then we connected it to so many of the chronic diseases and illnesses and other items that we talked about even into that next module. And so I felt very strongly about producing its own video. And also, I have some personal investment there that I kind of wanted to share just so I could justify my position a little bit more. But smoking took the life of my mother 20 years ago. And so I have a vested interest in uh, educating as many people as I can about the true risks of smoking and tobacco use. But also, I wanted to reiterate what I talked about in that first module here in substance abuse, and that is that patients need our friends and our loved ones. They all need our empathy and they need our compassion. They don't need our judgment and they don't need our contempt. And so, with that being said, I'm back here on healthypeople.gov and I'm clicking through topics and objectives. I'm scrolling down and I'm looking at tobacco use there. First of all, one of the things that we know is what tobacco causes. We have seen cancer, and not only are we seeing lung cancer, the leading killing cancer, develop, but we're also seeing throat cancer, esophageal cancer. But then take a look right into here, stomach cancer, which is a very dangerous thing because many times we don't even understand that stomach cancer has developed until it's far too dangerous and late in the game to do much treatment on. Liver cancer, another one, pancreatic cancer, all of these, kidney, ureter, all of these very dangerous simply based on the fact that they are very hard to diagnose until it's very late stage. Also, their bladder and colorectal cancer, two really common cancers that occur in life directly related to smoking. Heart disease and stroke also listed in there. So the number one and number four killers of Americans linked to, you guessed it, smoking. Lung diseases like emphysema, bronchitis, which are the number three killers of Americans. And then there's this fourth bullet here that has to do with reproductive effects. And it lists out things like ectopic or tubal pregnancies that can occur from smoking, also a premature birth. And what is that? Well, that's where the baby is born far before its time. And so if that is beyond or before 24 weeks, the viability of that child is very, very low, and the risk of death is very, very high. And then we also see low birth weight, which if you paid attention through our supplemental video through chronic disease, you saw that curve that was talked about there, and how being on either end of the birth weight, but especially that low birth weight, how that sets you up for so many chronic diseases later in your life. And so that is something else that we would want you to really give some attention to. Stillbirth being another big risk and a tragedy for so many parents. Reduced fertility in women, meaning it's more difficult for a female to get pregnant but also stay pregnant if she smokes or continues smoking through pregnancy. But that also has an effect with men in that there is erectile dysfunction. And so giving us a different perspective on how men's health or reproductive health is affected through smoking. There's some birth defects that are associated there, cleft lip, cleft palate, which is a devastating facial issue that can occur. I also point out this other effects down here at the bottom, but guess what? We've linked smoking to type 2 diabetes. And so there again, another link and modifiable risk factor that you can take out just simply by removing and cessation of smoking. Harmful effects of tobacco just do not end though with the user. And in this paragraph, what I want you to see here is there is no risk-free level of exposure to secondhand smoke. I grew up in a house of two parents who smoked, and I fear what that can do to me later in life, how that changed my body. And I want to show you some things here. And I have fortunately not had any type of asthma or bronchial issues. I do have several respiratory infections, throughout the year. Those have gotten better, I think, as the more I've gotten away from that time in my life. Ear infections, something that I struggled with a lot as a kid. And then this here, sudden infant death syndrome, SIDS, a travesty when it happens, or tragedy, I'm sorry, when it happens. And what we know is that SIDS is very common in homes where parents smoke, and secondhand smoke is a leading cause of SIDS. So why is preventing tobacco use important? We talked a lot about kids and what to do with that in that last module over substance abuse, but tobacco being the largest preventable cause of death is the #1 reason. But #2, smoking related illnesses in the United States cost more than $300 billion each year. And so it may not mean much to you as a student, but what we know is that healthcare costs affect our economy greatly. And if we could redirect that $300 billion away from smoking related illnesses, and let's just say, let's put it towards feeding homeless people or any number of better things, then look at what we could do. That's $300 billion going into things that could really impact other people's lives for the better. The Healthy People 2020 framework about ending tobacco here, there's several unique things that have occurred. #1, the price of tobacco products has increased. And if you use tobacco, you know that. I know personally that a can of smokeless tobacco costs somewhere around $2.50 when I was around 18 years old. Now I know that it's closer to around $6. So that has definitely influenced people and whether or not they want to continue using that product. I have no idea what cigarettes cost now, but I know that they're very expensive as well. There's a lot of smoke-free policies. I know if you enter our campus here at Carl Albert State College, you're not able to smoke or use tobacco while on campus. That is an Oklahoma State government thing. They've also expanded a lot of cessation treatments. We're actually going out and pursuing people and saying, listen, we have a plan. Would you please consider following that? Because, in many recent histories, the kind of typical thing was you should just stop smoking. Well, it's just not that easy. And if you ever tried, then you know that to be true. But there are now plans and settings where a person can actually find support and help. There's some hard-hitting anti-tobacco media campaigns, and right below this video I've linked you to a YouTube video of one of those, and I highly recommend you to watch it. When it's hard-hitting, it's hard-hitting. It's difficult to watch in many instances, but it's something that I find to be very effective in getting a person's attention. And apparently Healthy People 2020 did as well. They also want to control access to tobacco products, including e-cigarettes, which are not known to really be that safe of an alternative yet. However, we're seeing some data come in, but there's nothing that's proving it yet. Reducing tobacco advertising and promotion directed at children, and that's been very effective as well. So we come on back up to the top here, and I want to bring you into our interventions and resources. Lots of different articles there if you wanted to check some of those out. But right here, quit smoking. And I want to give this to you so that you have an understanding of where to go. First of all, here are some smoking causes or things that smoking causes. We've already kind of went through those. I do want to kind of also uh, point out some things that happen from secondhand smoke. Again, we're going to pick on sudden infant death syndrome. We're going to pick on pneumonia, bronchitis, asthma attacks, ear infections. But I want to get to this right here. How can I quit? What are some resources I have? The number one resource that you have are the people around you who can support you. But take a look at this. Setting a quit date, making a plan to deal with the cravings that are going to occur, asking your family, your friends, your coworkers for support, leaning on those people, and really pushing them to help you to quit. A phone number, 1-800-QUIT-NOW, but also visiting smokefree.gov. And I actually wanted to bring you to that website specifically. This is smokefree.gov, and there's some really unique things here because what we know is that there has been a linear change that happens when a person quits smoking. We see a incredible amount of positive things happen. Number one is you break that addiction cycle in your brain. Your hearing, vision, your mouth health, your skin all improve the moment you stop smoking. Your heart immediately has a decreased risk. Your blood gets better. Your cholesterol gets better. Your lungs are improved. Emphysema is decreased. You actually have a return of cilia, which are very important in the protection of the air that goes into your lungs. Your DNA, your epigenetics, literally changes, and your cancer risk goes down. Erectile dysfunction and sexual healing occur, proper healing, and that is very big because there's a lot of surgeons out there who won't even do surgery on a person until they stop smoking for a certain amount of time because they know healing is so impaired. You get a stronger immune system, better muscles and bones. And then I want to take you here to this fact sheet from the World Health Organization. And I find this to be incredibly impressive to me that within 20 minutes after you stop smoking, your heart and blood pressure drop. Within 12 hours, carbon monoxide levels, look at that, they drop to normal. 2 to 12 weeks, your circulation improves, your lung function begins to improve. At 1 to 9 months, coughing and shortness of breath decrease. At 1 year, take a look at this. Your risk of coronary heart disease, the main trigger for heart attack, is about half of that of a smoker in just 1 year. That's linear data that we've been able to reproduce over and over again. In 5 years after you quit, your stroke risk, the number 4 cause of death in America and the leading debilitating disease in America, is reduced to that of a non-smoker. 10 years after you quit, your risk of lung cancer falls to about half of that of a smoker. That's incredible things to see because what that tells us is just because you think, well, I've smoked all my life, now I should just continue. No, no, no. Look at the benefits that occur the moment you stop. And you see that all the way out to 5 years and 10 years. And what happens at 15 years? The risk of coronary artery disease is that of a non-smoker's. That's incredible data. That's very promising and things that we should really push and depend on. Let me go back to this now and talk about how to get to our kids and prevent that tobacco trend from continuing with them. Number one, again, find out what you already know or what your kid already knows. Number two, teach the facts. Give them clear rules. Again, we're going to not let our kids smoke in our home. And if they're going to smoke, they're not going to do it in our home. Be prepared to answer your child's questions. They're going to ask you questions. And so education, again, is key. Effort is unlocking the door. You educate yourself so that you can talk to your kids, teaching your kid how to say no. Again, I've already shown you this, but I'm going to do it again. 9 of 10 smokers started before they were 18. That means it's our job as parents and as loved ones to go out there and to illustrate what those dangers of smoking are. I hope that you'll take some of this information and that you'll employ it. I hope that you found this to be very interesting, but also very useful. Again, I want to say this, and our patients, our friends, our family, they don't need our contempt. They don't need our judgment. They need our compassion, and they need our empathy. And that's how we can install change in these behaviors. I hope that everything's going well for you. I hope you enjoyed this part of our talk. I'll invite you to watch the next video down. It's going to be very interesting. See you soon.